when I'm helping people. I'm Christina Stefan. I'm a South African professor in pediatric oncology. I'm the director of the Institute of Global Health Equity Research, Andrew Weiss Chair of Research. It is indeed my great joy and privilege on behalf of our institute to say three things. First, we are glad that you are here today, that you made your way to us here in Kigali in Rwanda. Second, you are welcomed by us, the Institute, our university, University of Global Health Equity, and by Partners in Health, PIH, as we believe this is a community where we would like to draw more, grow bigger, and faster. And thirdly, we believe that you are here today for a reason. Your presence is not by chance, random, but really has a purpose. And we are glad that you are taking your time, made the efforts to travel here to the site in Kigali, to Rwanda, from other African countries, Kenya, Ghana, Malawi, Lesotho, from Europe, from UK, and United States. Allow me, on behalf of the team, members at the Institute of Global Health Equity Research, and myself, we are really honored to host you here today while we travel on time talking about the story of the Institute, the founders, their dreams, about our team, about our university, a university with a unique mission in the world. And while we also share common aims with our bigger family, PIH, and all they and our supporters and collaborators. Welcome and thank you for coming today. The launch of the Institute comes at the right time, at the right moment, as H20 Summit, G20 Health and Development Partnership meeting just took place a few days back in Geneva. And during a period of growing uncertainty globally, now is the time for us, global health researchers, global health activists, scientists, policymakers, global health community, to focus on global health issues. Of course, looking at the growing number of non-communicable disease, climate change, health of the digital age, and so many others. And again, a significant coincidence is that my story started in September. And September is also the Childhood Cancer Awareness Month. So more to celebrate our victories and also to plan for the path for the future. We have a full agenda with speakers, supporters, collaborators, a message from the funders, a great presentation on research in Africa, and of course a description of our institute with its ambitious objectives, dreams, and wishes to fulfill for a better and wealthier and healthier world. I encourage you to be present, to be bold, to take advantage of listening to us as we reflect on the past and we prepare our future and we take time to share with you our dreams and the way forward. Distinguished government representatives and officials, guests, faculty, fellows, researchers, private institutions, online viewers and listeners, a warm welcome to the launch of our institute. Thank you. So it gives me now great pleasure to introduce to you Professor Bebe Bekele, who is the Dean and our DVC Academic and Research Affairs at the university. And I think I'm not making any justice to introduce him because he's got such a rich CV and he wouldn't allow me to really talk about him. And maybe he is right, because from a certain point of view, if I say Dean and DVC Abebe, everybody will know. So
thank you.
Please, the floor is yours.
Thank you. Thank you, Professor Christina. Vice Chancellor, Dr. Patrick, our guest speaker, all protocols observed. Welcome to the official launch of our Research Institute, properly known as the Institute of Global Health Equity Research. UGHE is a young institution. It's 7 years young. At the moment, we have about 11 academic units and about 4 academic programs. But not by incidence, by coincidence, but by design, the Research Institute is one of the strongest and one of the institutes, the academic units that we are really proud of. And let me begin by first sending my vote of thanks to the members of the Institute of Global Health Equity Research. May I ask members of the Institute to stand up and get recognized? Dr. Majdi, I think you are a member of the Institute. So these are the people behind the architecture, the design, and the launch of the Institute. I must also acknowledge the former director of the Institute, Professor Timothy Carey, who has finished his contract with us and went back to Australia a few months ago. He also deserves one good round of applause. Research is an integral part of UGHE. We take it very seriously. Our medical students, MGHD students, and all faculty and staff are heavily engaged in their own research, participatory research, and it's highly encouraged routine here at UGHE. And hopefully, this institute will be the pillar institute that drives such a movement at UGHE. I would like to stop my introductory remark here, but I cannot stop without introducing the next speaker, that is Professor Agnes Binagwaho, the current Vice Chancellor of UGHE. I need to introduce you, Prof. Give me 1 minute. She's currently the Vice Chancellor and co-founder of UGHE, which is an initiative of Partners in Health in Rwanda. She's a pediatrician by profession who previously provided clinical care in the public sector and has served in the Rwanda health sector for 20 plus years in high-level government positions, first as Secretary of the Rwandan National AIDS Control Commission, and then as Permanent Secretary of the Ministry of Health, and lastly as Minister of Health for 5 years. She is currently a Professor of Pediatrics at UGHE, a Senior Lecturer at Harvard, and Adjunct Clinical Professor of Pediatrics at Dartmouth Giselle School of Medicine. She's a member of multiple editorial, advisory, and directors board, including the Think 20 and the African Union Commission on COVID-19 response. She's a member of the US National Academy of Medicine and the World Academy of Science and a fellow of the African Academy of Science. She has published over 240 peer-reviewed articles and was named among the 100 most influential African women for 2020 and 2021. Professor Binagwaho is a recipient of the 2021 L'Oréal UNESCO Award for Women in Science for Africa and Arab States, and the 2015 WHO Prize and the 2015 Ronald McDonald House Charities Award of Excellence. Ladies and gentlemen, the Vice Chancellor of UGHE.
After all this, you understand that I'm retiring, huh? So, Dina Bebe, thank you for your kind introduction. And I just want to say that all those achievements are not mine, they are ours. There are many people that, some of them are here. We have worked together, and it's a collaborative success and collaborative achievement from the past 22 years that I'm working around those subjects. So, I'm very pleased to welcome you to the launch of the Institute of Global Health Equity Research. So it's something that is very important and has always been important to me. And I have former colleague here who will tell you that if I have achieved anything in my life, it's just because I always did research about what I was doing. And this has helped me to improve and found in the context where we are, the capacity, the resource, the human resource, the financial resource, the ideas to improve. So, as we all know, the University of Global Health Equity has in its core mission and vision to improve how health services are delivered, especially for the most vulnerable. This part of the sentence in our mission is one of the most important. There are many institutions around the world that are working around excellence, but there are very few who have a focus on the vulnerable. And this Institute of Research, equity, has also equity in its name, because the research that they will promote, that IGHER will promote through this institute, it's also to improve the way we provide services, the way we improve health, and the health outcome of the vulnerable. And of course, we can see here, thank you for the representative of UNICEF to be here. Thank you for the people in the private sector that has joined you like Roche. Because what I want to say, thank you for other NGOs. Thank you, Dr. Patrick, to represent here, to be our guest speaker and represent here the Minister of Education. This is the example of how we are working in partnership. It's an academic institution based on the reality, on the ground, what the community live, and we can only do that if we partner with all the stakeholders and the community we want to serve. So, we are very proud to launch officially the Institute today. They will promote quality institution research that really will promote equity, not only in Rwanda, as our students are coming from all over, but also our partners are from all over. Also, we meant to improve quality research for the vulnerable across the world. So, we are based in Africa so far, but we know that there will be other IGHER somewhere more quickly than we can believe. And it's very important because if Africa has 25% of the global burden of disease, only for 17% of the global population, I have the data here. Africa produced only 2% of the research results in the world. That's a drama, because that means the solutions that are found through research doesn't necessarily suit who we are and what we need in Africa. So we need to promote research on our continent, and this institute will do that. Need also to understand that this institute will promote the mobilization of funds for research, to promote the education of quality researchers, so that we can produce data that responds to our need in this continent. For the time being, we should not be blind. It is not the case. So, let's be ready to see Christina and her team to revolutionize the world with the other members of IGHER, with the partners of IGHER, visiting lectures of UGHG, and supporters of UGHG. We are here, of course, for Rwanda first, for Africa second, for the world. We need to set the example. From this country, the example has to radiate across the world what we have to do for the vulnerable. And we have a very good ground to do that because it's a good country to make it happen. Because the vulnerable are in the center of many of the policies here. In many countries, it's not the case. And we all know that it's not about economic growth only. It's about philosophy, it's about policies, and it's about what we want to achieve. Whatever we do with our students, with our partners, it's always for the community we serve and the community for whom we are going to do research for better service delivery. So, we are very pleased, Christina and the team, to launch this research institute because we have a heart like that, but we don't know if we are doing good. Only the research will tell us if we do what we are supposed to do. If we have extract the maximum of the opportunities we have. If we have targeted the best human resources and use well the financial resources we have. So, I'm very happy today, especially because it's my last official duty as a Vice Chancellor. It's great, because my colleague who are there will tell you how I have done research all along my life. Even when I was a minister, they were saying, when does she sleep? It was so relaxing to do research. And also, we have put that spirit in the people in public sector, isn't it? That's how Rwanda, with a GDP of less than $800 per capita, is doing far better than our neighbors who have 3 times the money we have. So never forget, you want to improve, do research. You want to improve, implement the result you have. So, I can't say how pleased I am. Congratulations again to you, to UGHG, to our partners, and we are there to support you, to support the world to do quality research for the vulnerables. Thank you very much.
Thank you so much, Professor Agnes. Indeed, that was one of my questions. When are you sleeping? Because it seems like she's always busy or on a go, either researching or teaching or sharing her wisdom. So we listen again to another inspirational talk, as we have been used for so many years. I mean, at least from my point of view, for the last 10, 12 years, since I know Professor Agnes, and when she was the Minister of Health. And I'll definitely not forget being the first, and I might say maybe the only Minister of Health who really started the guidelines in treating children with cancer and getting all of us together, from South Africa to Senegal to all the other countries, Namibia, Zimbabwe. I remember that day very clearly, with our colleagues from PRH, already with Butaro, with our colleagues from United States. So I will keep deep in my heart for many years to come that memory and that inspiration that you represent to me, and not only to me, to all of us. So thank you so much once again. Next, we have a video from our founder, Andrew Weiss, who is the co-founder of the CRI Foundation. But before I would ask the team to play that recording, I would like to have a short introduction. Some of you might know Andrew Weiss, some of you might not, so I will try in the next few minutes before the video to have a short introduction. So, who is Andrew Weiss? Who is the founder of our institute, and how much do we know about him? So I would start by describing him in 2 words. He's a brilliant mind. And the testimony is not just a statement that I have without any evidence. So really, as a testimony, I have the over 60 articles published in professional journals and ranking in the top 1% published economists by citations. And we are talking about economics, so definitely not medicine, so it's really a huge number. So nearly 6,000 citations. He is a professor emeritus at Boston University with a PhD in economics from Stanford. And I would continue adding this statement from Boston Globe. And I'm reading. He is a brilliant economist. He's an outstanding investor. He's scrupulously honest, and I trust him with anything. So Weiss Andrew co-founded, together with his wife, Bonnie, the CRI Foundation, a foundation dedicated to fighting poverty in less developed countries. They also founded the Weiss Family Fund, which supports research in development economics at 10 leading universities. So when talking to him, one of the first phrases that you'll hear is about his efforts directly towards relieving suffering. And I need to add that he is leading the Weiss Asset Management with more than 80 employees, a firm which he has led since 1991. We judge ideas, it's what he says, by their merit, not by their pedigree. At Weiss, we have uncompromising commitment to rationality and use a cerebral approach to problem solving. We promote continuous learning, which we identified very well, and improvement, because we believe that by understanding our mistakes, we make progress. And something which again is said over and over again, repeatedly about him, is honesty and integrity. Again, among the values of his firms, which I had the chance to research slightly, the following statement weighs a lot. We value integrity, intellectual honesty, creativity, and collaboration. Our culture is more important than any individual and more persistent than any strategy. Andrew likes to tell new hires, never do anything that you wouldn't be proud to tell your kids and grandkids about. And I will end with one of his statements. We believe people matter most. So, Andrew Weiss, a brilliant mind with honesty and integrity and the sense of humanity to help make this world a better world. We are fortunate to have him as our founder and a friend in Rwanda. So I'm going to ask now to play his video with the address to the audience.
It's a great privilege to be able to represent the CRI Foundation here. A little over 15 years ago, my wife Bonnie and I set up the CRI Foundation with the intention of alleviating suffering. We started out doing things in Haiti, actually, and then focused on Africa. We've been great supporters of the work poor farmers have been doing, and Rwanda in general, IGHER. The foundation's evolved, and now it's run by my wife, Bonnie, and my daughter, Kara. Let me talk a little bit about my background and how I got to this point, and why I think that funding an institute like this is the best way to alleviate suffering in the long run. So when I graduated from college and decided to go to graduate school in economics, my intention was to study development economics, because I had this somewhat pretentious idea that I was going to make the world a better place. And I got to Stanford, I took a course in development economics. This was in the mid-70s, which kind of dates me a little bit. And in those days, it was sort of coming out of the 60s period when Russia was supposedly doing so great. And the idea was central planning was the thing to do. So you would look at input-output matrices and figure out, well, the central planner decides we need so many trucks and so many TVs and so many radios or airplanes, and then solve this input-output matrix and some linear programming and nonlinear programming problems, and tell you how much steel you need, how much aluminum you need, how much cement you need, and then how much limestone you need to produce the cement, how much electricity you need to produce the steel or aluminum, and you solve this big problem. It was the most boring course I've ever taken in my life. It was just matrix algebra and linear programming, and I wasn't going to spend my whole life doing linear programming. So I dropped that idea and ended up doing economic theory, which was really quite fascinating, especially because I was working on things like market failures, hopefully to help the world be better, figure out how you can address unemployment or credit rationing or depressions. Then as the foundation evolved, it started doing direct aid. We started making some money. I left academia. Last time I taught a course was in 2000. So we set up the foundation probably around 2003, at the end of 2003. And we started doing direct aid. We did things like sanitation in Haiti, and then we were doing a lot of other direct aid stuff. Right now we're doing things like food, but we also ventured into some research stuff where we were supporting research and development economics. There's a trade-off between direct aid and research. Direct aid, you can see, is saving lives. I mean, you're giving food to malnourished kids. That has a huge impact, and I'm very proud of what my wife and daughter have done in finding really great providers. But in the long run, it's sort of like the difference between giving people a fish and teach them how to fish. In the long run, the big progress is often made with research. Basic research on germs, the germ theory of disease, probably saved more lives than almost anything you can imagine. And this was very fundamental research, teaching doctors that they had to wash their hands, hand washing, having clean water, having good sanitation, has a huge impact on people's lives. So the Institute, I think, can have an enormous impact on people's lives by getting research that will address the problems that very poor countries face. Why can't they be solved without the Institute? Well, the problem is that there's this big disconnect between where the research money is, where the researchers are, and where the problems are. And in particular, where the trial participants would be if you wanted to do clinical trials, or even if you want to do population studies, what's the population you want to study? So if you want to develop a vaccine against schistosomiosis, it's almost impossible to do it in the advanced countries. There just are not enough cases of schistosomiosis. Malaria vaccine, similarly, you just can't do it. Elephantitis, leprosy. And even if you wanted to do a treatment, it's very expensive because let's say you had a treatment for leprosy, there might be enough cases in the US, maybe not, there might be, but they're scattered all over. So you'd have one case in Detroit, another case in Atlanta, another case in Boston maybe, or some, who knows. And it'd be very hard to implement. So where the cases are, we have the trial participants are in poor countries. But the poor countries, it doesn't have the infrastructure to conduct the trials or the trained investigators. So I envisioned the institute. I started talking about the institute when I talked with Dr. Benawaho on our porch about 5 years ago. We envisioned it as developing the cadre of enumerators, nurses, implementers to conduct the trials, training principal investigators. There have been some really exciting developments that happened more recently. We were talking with the Brigham and Mass General Hospital to partner with UGHE in support of the Institute to collaborate and bring the principal investigators and the expertise that you have at these leading hospitals and Harvard Medical School as well, perhaps, to bear on these problems. They can mentor the investigators. They can get the funding to do the research, and the Institute can train the cadres that they need to be able to do the research. We can also develop a biolab on the tissue samples, fecal samples, saliva samples of patients that will help evaluate the research and make the research more meaningful. This is incredibly exciting. The hope is, and my belief is, that we are going to just change the world. And it sounds pretentious, but I really think we are. And the way we're going to change it is by taking risks. So I want to warn everybody, there are going to be plenty of failures here. Because we're not going to just figure out how to make a foam version of a liquid that you put on your skin to alleviate some rash. We're going to be looking at path-breaking innovations. And some of those won't work. But you can have 10 failures if you get one penicillin. That justifies all those failures. And they're going to be shooting for the stars. And I'm personally just so excited to be part of this venture. The foundation, with the approval of Bonnie, my wife Bonnie, and daughter Kara, has made a very large financial commitment to the Institute, and we can look to partner with Gates and perhaps with the Cummings Family Foundation and other people who are advocating at CGI, the Clinton Global Initiative, to see if we can really make great strides forward in addressing these incredible needs. There's hundreds, literally perhaps over 600,000 people a year dying of malaria. Every year it just keeps happening. That's inexcusable. We believe firmly that the value of human life is not determined by where they were born or the country on their passport, but all human lives have equal value and deserving of equal respect. And if you get a child dying of malaria in Burundi or Rwanda or the DRC is just as painful as a child dying of malaria or some disease in the US. And we're going to put our resources right behind that conviction. And I hope you are excited about being on this journey with us as I am. And thank you.
Definitely a great speech, and I can assure Andrew that we are just as excited as him to go together on this journey, and also to assure him that, yes, I also believe we are going to change the world. Change the world by the way of how we are going to do research, innovative research, and also the way of how we are going to teach and train our generation, new generation, future generation of young researchers and scientists in Rwanda, but not only in Rwanda, in Africa, and we will be setting an example for the world. So this being said, next I should present to you the research priority. So the Institute of Global Health Equity Research, the research priority and the vision moving forward. Unfortunately, I have only 15 minutes. I would love to talk about that for so much more. And we challenge ourselves as we brainstorm together with the colleagues at the Institute, and now adding the family of PRH, also brainstorming together what would be the next priorities, what type of research should we do. But I will try to summarize it in a short presentation. So I would start saying that Africa of tomorrow starts with our actions of today, which we need to transform our imagination of a better world into reality. Health to become equally accessible to all. And again, I'm going to use one of Paul Farmer's statements. Equity is the only acceptable goal. So let's start with a question. Why the launch? And why now? So a justified question. 2 years ago, the Institute was created. And I need to acknowledge the previous director, who unfortunately crossed a difficult time, as it was exactly the time of pandemic. So the Institute, like many other institutes, crossed these challenges, but despite this period of time, it was still created the base of having preliminary ideas, creating documents, and really creating the structure that we are building on from 2022 in March. And I keep on using as a reference March 2022, where I believe that we have moved from I am to we are. So we are Africans and understand the power of togetherness, and we also move from questions to actions. So the launch today is not about questions as a strategic plan, but for me and hopefully for you as well, it is about people. It is about writing our narrative, defining our values, and keeping our culture. The launch today is about one, and I'm specifically looking at Joel. The launch today is about one in the bigger version of one. It is about us getting together and collectively moving the global health agenda towards equity. Our power stays in one as we unite forces, minds, and common goals. So the launch today is a promise which we make towards you all, towards the global health community, towards us, towards our patients and communities, that there is no return. We want Africa to know about us, the world, and that equity, again, is the only acceptable goal. Launch comes with action and responsibilities. But before describing really our strategic plan, our vision and mission, I would like, perhaps, just to describe with pride what we have achieved in these last 6 months since we started writing our story. So in 6 months, we redesigned and created the vision, mission, and objectives of the Institute. We did a survey to the faculty to understand the needs and the gaps and their main areas of interest, because global health is so much more. It is about the right to care, which could be applicable to all diseases, systems, policies, and so more. But we needed to make a wise choice on our first priorities. We restarted the research repository initiative, and then we added to the grant submission, publications, research projects, a collection of really innovative research projects where we think we could start changing the way of how healthcare is delivered, training is offered, and how access is at reach, or how access is provided to the poorest. We did the research day at the University of Global Health Equity, and I need to acknowledge the help of our colleagues from Institute of Global Health, who really supported us. Quiz and knowledge promoting research among master students. We just finished 1 week of research training to medical students, and I'm glad that the team who was in Butaro from Sunday made it successfully, came back successfully yesterday to be part of the launch. We also did a research training for fellows at King Faisal Hospital with the support and collaborating with our colleagues at University of Rwanda. Some of the fellows are in the audience from different disciplines such as pediatrics, endocrinology, obs and gynae, with whom we are going to continue working on their research projects. We started a journal club with NIH, again inviting the faculty and the PIH. We needed to learn all the departments at the university because we part of the university. It is the Institute of Global Health Equity Research, but we are part just as much as the university, as we are one. So we started to learn from nursing to executive education to community to basic science to clinical services, to understand their strategy and needs, and looking at ways in which we could collaborate and work together. We introduced a visiting international fellowship program, which again seems to be extremely popular, as now 2 of our fellows are sitting in the audience, one from Geneva Institute and another one who just landed in Rwanda 2 or 3 days ago, coming from United States. We are introducing a guest speaker monthly program with interesting topics and great scientists. Drafting memorandum of agreement with several institutions, from Switzerland to UK, from Harvard to Princeton, to many locals in Africa. I think it is tremendous potential for all of us to work together. And maybe intentionally, I left towards the end of our 6 months achievement our interest in working together within the larger PIH community. Maybe because we see the Institute as a connector within Africa and the world, so it appears normal for us to reach to all the other colleagues, either in Lesotho, Malawi, Sierra Leone, while we partner with IMB, PIH Rwanda, to know each other better, to understand the gaps, and collectively planning to meet and to establish our next strategic plan. We have been invited to give talks about our institute, about BIH, and the one whose vision is bringing us today together, even if he's no longer with us. Paul Farmer, who continued to live through us, and I believe he smiles happily as we remember again one of his quotes. With rare exceptions, all of your most important achievements on this planet will come from working with the others, or, in a word, partnership. We had, of course, the rhetoric question, could we have done more? That is always essential to stop, at times, reflect, and analyze and prioritize. We needed time to know each other, to create a safe environment where each member can talk openly and freely without the fear of being judged or criticized. I truly believe that our leadership can be defined by transparency, empowering, and freedom of actions. Mentorship for younger generation is just very, very high on our agenda. So I believe the audience does not need another PowerPoint presentation, and I do not have any slides to share with you, but maybe two simple things: a clear path and a destination. So if anyone would ask us, any of the member, how do you define the Institute of Global Health Equity Research in a few words? And we thought that perhaps what defines us is research, innovation, impact, and of course, equity. As you all have heard, we have embarked on a journey to become Africa's leading Institute of Global Health Equity Research, recognized not only in Africa, but worldwide for our innovative approach, impact, inclusivity, and togetherness. And again, perhaps you'll not be surprised that our narrative connects our people to our institution. So our institute is defined by young members, vibrant, energetic researchers, I believe with great moral values and inquisitive minds, whose scientific curiosity shall lead to ambitious discoveries in the service of health equity. Looking ahead begins with knowing who we are. It helps us understand who we can and who will become. And before really sharing the strategic plan, I would like just to mention the values that define our brand personality. We are inclusive, determined, understanding, innovative, and again, equity-based. This is what makes us unique in the world. The Institute has the African community in the center. And again, this is a statement that we know. We start knowing that the best research you can do is talk to the people. And of course, the Institute is at crossroads, advancing high-precision medicine research and also training the next generation of top-class researchers in Africa, and I would dare to say, in the world. So we are planning to produce the most impactful and innovative research to support also science and discovery, while not forgetting and addressing the needs of the community and contributing to reduce health inequalities. Again, while having the African community in the center, the Institute responds to the current relevant research questions while looking for solutions for the future. So part of our strategic plan, we have a research training platform. We need to continue investing in training and development of the next generation of students, masters, PhDs, postdoc, researchers, using innovative ways of acquiring and sharing knowledge. In research, and you have heard clinical trials, and research leadership, which is just as important, using e-learning, developing dedicated learning platform research. The research training will also include new knowledge in immunology, molecular and computational biology, expertise in data science, competence in population studies, community-engaged research methodology, amongst others, and of course, along the time. We believe that these are just some skills where we should invest to make sure that the scientists can meet the challenges of today's research landscape, but more important, of tomorrow. The second pillar of our strategic plan includes a research platform. And to create a research platform, we need data and we need samples. So you did hear already from the founder about our clinical trials unit. And we would like really to understand better the African patient's response to disease and to the treatment. So we need to understand better the African culture, the ethnicity, the behavior. So we are planning to build this platform, adding more data and samples to help us learn from every single patient. Those who we have successfully treated, as well as those we have failed at that time to help. Of course, we have big dreams and big wishes, and I need to stop perhaps here for a second and pause and say that we wouldn't be able to do that without really working together with the government, working with the Ministry of Health, working with the Science and Technology, Ministry of Education, IT, the government, and collaborate fully to integrate and align all our wishes and dreams to make it a common strategy for all of us. And again, Rwanda leads in many aspects, and we would like Rwanda to continue or to take to even a higher level the leadership and actually expand it to other African countries, as already does. And thinking only about one of the examples, and again being an oncologist, thinking about the success which Rwanda has, for example, in the HPV vaccination. Just the first example that came to my mind. So clinical trials is another pillar of our strategic plan, as we believe there is an urgent need to increase clinical trials in Africa. From 2.5% clinical trials current rate in Africa for a burden of disease more than 69%. We need to also modernize our thinking and adapt it to our local situation when designing trials to make them work better for our patients and providers. Again, perhaps new and innovative trials available in community settings where patients live, and encourage more patients to participate and also to take advantage of the state-of-the-art therapies and boost enrollment using new technology, new digital tools for monitoring and communication through platforms, and design innovative clinical trials to be faster in obtaining results. I need also to mention our wish to have an African Cancer Alliance, to be a connector, to be a catalyzer, and creation of a cancer research and innovation hub for Africa, meeting the patients where they live. I think it will be really a synergy between us and our colleagues in Butaro and the oncology center where they have, where we could put our minds together in a collaborative way, looking to improve cancer care and prevention and diagnosis for all the patients. So the African Cancer Research and Innovation Hub, I would call it a first for Africa in a sense that we imagine as interdisciplinary center, which includes really dedicated new innovative programs. So, of course, the aim in this case would be to accelerate progress and to address the equity in cancer care and reduce disparities in Africa. And perhaps one other wish or dream or pillar of our strategic plan would be the digital technology, research, innovation. So we need to be innovative in anything that we do because we need to make progress faster. We need to catch. We just don't have the time. We are really trying to change the world and catching up, and more than that, really moving faster together. So digital technology health research, I would say, is an essential component in the view of the need for Africa to own its narrative and to adapt innovation to local context, and for stakeholders to ensure that policies and practices are developed with a greater awareness of the local context. Again, I believe we owe it to our patients. We owe it to our patients to make progress against all diseases, not just some of them. To advance research while we understand more about health particularities, and to reduce inequalities in healthcare in Africa and everywhere else in the world. Again, we will work together with everyone who is supporting us. And this is, again, a call for action, working together with the ministries of health, with the government, being aligned with RBC, with the science of technology, really getting into this together. We will need you to continue the Rwandan leadership and actually expanding it to many other places in Africa. The Africa of tomorrow starts with our actions of today. And I would like to pause and ask you, the respected audience, my last question of this speech. If not us, then who? And if not now, then when? Thank you. And I think this institute would not exist without its members, which we do not have enough time to ask them and introduce themselves. So we decided to create a collage of the members of the institute, which we are going to project now. The Institute of Global Health Equity Research is part of the University of Global Health Equity based in Butaro, Rwanda. As a pediatric oncologist, my main task for more than 25 years was to treat children with cancer, one of the most emotionally challenging but also rewarding careers that anyone in this world could dream of.
What made me join the Institute is that I saw this as an opportunity for growth, not only for myself, but also for the next generation of African researchers.
My reasons for joining the Institute of Global Health Equity, in fact, the interest dates back to 2019 when I first visited Rwanda. So I thought this is the Institute actually offers the venue for more collaborations to bring in research funding and to help train the scientists from Rwanda and within to address issues of global health.
Before joining IGHER, I worked as a medical doctor in both rural and urban hospitals here in Rwanda. I noticed some undocumented challenges due to lack of equitable research in all health aspects. For instance, we used to rely on evidence generated by others in our daily practices because very few clinical trials take place on the continent, yet Africa represents the most diverse genome in the world, and this leaves many health issues unaddressed. That prompted me to join IGHER to contribute to health research for equity.
My goals in life are to conduct meaningful research projects and to improve health equity for my patients.
When I came to Rwanda for the first time, I was looking for a host institution to support my research permit application. Given the prestigious status of the University of Global Health Equity, it was the ideal institution. In fact, it turned out to be more than ideal. The IGHER has an international team full of talent and expertise in global health research, and a strong network in the health system of Rwanda.
I'm Abel, I'm a visiting fellow at IGHER. I was first made aware of the Institute's work through the University of Global Health Equity, and then through a fellowship that I received, I was able to come as a visiting fellow. Joining the team here was an easy choice for me, as it presented the opportunity to work with and learn from passionate leaders from across Africa on a project that actually mattered to me. While here, I'll be working to identify barriers in accessing cancer screening and diagnoses, and thinking about potential solutions.
IGHER focuses on conducting research, and second component is training. So joining an institution that combines both research and training is an opportunity for me to liberate that.
I joined the Institute of Research because I was curious as to how research can contribute in eradicating health inequities in Rwanda, in Africa, and in the world.
For me, global health was born through global oncology, love and care, empathy, and sharing protocols so much needed on the continent. The commitment and passion and of partnerships and collaboration on the continent, which was so much and is so much supported and encouraged by many in all parts of the world. The Institute of Global Health Equity Research is also about bringing the best scientists in Africa and also unite them with the best scientists and researchers in the world. Why? To focus on some of the most critical problems in the world. And it is also to be able to produce the evidence so much needed for transformation and change.
The research I plan to do when visiting the IGHER is part of my doctoral project to study the impact of social health insurance on the incentives of healthcare providers in East Africa.
So what I really bring to the Institute is my experience. I have trained various students at undergraduate and master's level and have been successful in many competitive funding opportunities.
In terms of focus on research, I would like to see more researchers focusing on both infectious as well as non-communicable diseases, which has been in the rising over the last decade. And in terms of research gaps, I see three important research gaps. One is translation of research into policy and action. I think we lack that in Africa. IGHER is pioneering in terms of conducting implementation science research training in Rwanda and setting researchers in Africa.
For a young female scientist in the field of research, which is predominantly filled with male scientists, let me tell you something. Science is not only for men. You can do better and you have everything it takes. I personally used to doubt myself in science because some people used to doubt me. But one day I told myself, if others can, why not me? So since then I had to stand up and see where I am now and still growing day after day.
There are many challenges and inequities we're facing in the world today that I believe as an institute we can challenge ourselves in creating solutions for today and tomorrow.
And I'm very confident that we will be able to do this. We will be able to shift the center of gravity for Africans by making sure that our trainings are tailored towards addressing the equity challenges that we face as Africans.
As one of my great influencers, Nelson Mandela, said, education is the best tool, weapon to transform the world. Our institute is advancing well on the mission of training and forming the next generation of researchers, scientists, women researchers and scientists, health leaders who will stand on our shoulders and see a broader horizon for all. That I have the best team ever, the most amazing research ever, and I'm really bursting with pride for everything that they put together, for who they are, their commitment, and their really wish and dream to make the most innovative and impactful research that we need so much. So thank you to all my team members, and maybe they deserve another round of applause. So we are moving on the agenda, and it gives me great pleasure to introduce Dr. Joel. I could call him a colleague, or I would love to call him a friend. He's actually the executive director of Partners in Health in Rwanda, so IMB. He joined PRH a long time ago, so in 2011, and he successfully led the decentralization and integration of NCD and mental interventions in the district of Burera, as well as the mentorship and quality improvement interventions for primary healthcare services, including maternal and child health. From 2013, Joel provided advisory and program leadership to the Ministry of Health Human Resources for Health Project, where for 2 years he supported government efforts to develop training programs that will produce a cadre of qualified health professionals in collaboration with more than 20 United States institutions. He holds a medical degree in general medicine and surgery from the University of Rwanda, and a diploma in tropical medicine from the London School of Tropical Medicine and Hygiene. He is currently completing his MBA in strategic management. He is also one of the founders and current vice presidents of the Rwandan Christian Medical and Dental Organization. And it's not written here, but I would add, he's just a great guy. Thank you.
Thank you very much, Christina, for the generous introduction. Distinguished partners, colleagues, and friends, good afternoon. I would like first to thank the organizers, the entire team from the Institute for this important day where we are launching the Institute. And most importantly, I would like to congratulate you, or I can say congratulate us, for the courageous and unique commitment to create and disseminate a strong base of knowledge that focuses on the eradication of global health inequity through this institute. The Institute of Global Health Equity Research could not sit in a better place than the University of Global Health Equity. The idea behind the creation of the university, its location in the rural community of Rwanda, its academic programs that put each and every patient at the center, the incredible work of Partners in Health in Rwanda and across the world, and the unique context of Rwanda health system are all strong foundation for the success of this great institute we are launching today. Achieving equity, I should say, is at the same time aspirational and an urgent necessity. An urgent necessity because the suffering caused by any type of inequity is simply a violation of a basic human right. and an aspiration because the major obstacles to equity are primarily historical and systemic, which make it a very difficult fight to overcome. And when I think about the Institute of Global Health Equity Research, two major historical and systemic challenges came in my mind. First, the diverging needs between global health research collaborations from the global north and the global south. At one hand, you have the institutionalized pressure to secure for grants, to be first or second author in order to climb through the ladder of a well-structured career path. And on the other hand, you see the unfitting time trade-off for patient care due to limited personnel, the lack of research training opportunity, language barrier, and an unclear path as a researcher. The second challenge that I could see is also the structured inequity on how research priorities are defined and how research funds are accessed. And some of my predecessor speakers talked about that. The reality is that the majority of grants are reviewed by experts from high-income countries who, in many cases, would like the first-hand experience of the country where the project will happen, and will review application a set of criteria that will often penalize the researchers from the global south. And the funding system will often prioritize cutting-edge sciences or donor preferences at the expense of research projects that may have more meaningful impact on the most vulnerable population, and sometimes even dictate how those funds should be spent. So those systemic issues should be part of the innovation within the Institute. And as we launch the Institute of Global Health Equity Research, the main challenges should also be to build systems and practices that will overcome the prevailing systemic challenges that I just mentioned. The good news is that increasingly more research centers in country, in the region, within the PH network have been pushing for that work, have been fighting for more equitable access for funds, substantial capacity building for local researchers, and priority choices that are meaningful to the local context and impactful to the most vulnerable population. The Institute of Global Health Equity Research comes to build on those efforts. In Rwanda alone, PIH, in collaboration with the University of Rwanda, the Rwanda Biomedical Center, and other partners, in the past 8 years and more, have published about 200 papers relevant to local context, provided research training to more than the same amount of people, now 200 healthcare providers, policymakers, academicians, and launched annual national research and policy symposiums. Our close collaboration, expectation, and hope for the Institute of Global Health Equity Research is to sustain those gains and to scale up our joint research production capacity. With that hopeful conclusion, I will close my remark by again congratulate UGHE, Partners in Health, the Minister of Health, different partners who are here present for the launch of the Institute of Global Health Equity Research, and for organizing this beautiful and colorful event. Professor Christina, thank you specifically for your leadership and your entire team, and I wish all of us a great celebration. Thank you very much.
I think it becomes very clear to all why we really form one. So it will be really togetherness, us together working towards more impactful research and together training in the most impactful, innovative way the next generation of researchers in Rwanda, and not only in Rwanda, in Africa as well. So thank you so much. We have a number of collaborators and supporters who unfortunately couldn't be here with us today, but they send their messages of support and their congratulations. So the communication team got us a collage of these collaborators and supporters from different corners of the world. So I would like them to just project for us this recording.
Hello, I'm Roger Glass, Director of the Fogerty International Center at the National Institutes of Health and the Associate Director of Global Health at NIH, and I'm honored to be with you today. 17 years ago, when I was considering taking this position, I met for breakfast with Howard Hyatt, Jim Kim, and Paul Farmer, and they laid out their plans for Partners in Health for their department going forward over the next decade and a half. And these were ideas in dreamland, and only this group could possibly accomplish this. I've seen what's happened over the years. I was present as the first speaker to the Master's Program in Global Health Equity, and I was present last December 2021 at the White Coat ceremony presided over by Dr. Agnes, the Dean Abebe, and Paul Farmer. An amazing event leading to the training and accomplishments of a medical school and a hospital being set up on the hills in Butara. Amazing events taking dreamland into action. And this was only possible because of Partners in Health. All the friends of Partners, Dr. Agnes and the Dean Abebe, members of the board, Ophelia Dahl and Sheila Davies, and many, many more. We're all in this together. You know, academic centers arise because they have a three-stool formation: delivery of care, training the next generation of physicians and scientists, and research. And research is a very important component. At NIH, we invited Paul to speak to us about global health and his vision when I first got to NIH. And at the end of that talk, we planted a tree in front of the stone house at Fogerty in his honor. Well, that vision that he laid out, including research, is what we're celebrating today. And I have to really thank the contributions and the generosity of Andrew and Bonnie Weiss for their contribution to this, to beginning this institute, and to Christina Steffen, whose vision it will be to carry this out over the next several years and to expand the institute into other parts of Africa. We feel at NIH that research is an important component of medical education and education in the health sciences. We can't do today what we've been doing for the past many years. We have to improve it, both for advances in science and for advances in health equity. And that's what this institute will do. So on the occasion of this launch, I just wanted to give you a heartfelt congratulations on this momentous event. You really have now all the components of a center of excellence in Rwanda, in Africa, that will train people and contribute to the improvement of health throughout Africa and the world for years to come. A momentous event. Congratulations to you all. And I'm sure Paul is smiling on us today as he looks at the completion of this amazing vision that seemed like dreamland only years ago. I wish you well in this endeavor, and I could only wish I could be with you today, but I will plan to visit sometime in the near future. I am an enthusiast for what you are doing. Thank you so much.
I am Professor Jacob Soppi from Université Libre de Brussels. I am expert in biotechnology. I studied molecular genetics and molecular biology, and apply this knowledge on a couple of research interests, particularly in Africa. My interest is to address malaria resistance to treatment with artemisinin-based treatment. So in this line, we want to address how far mutation is circulating in African community and here in Rwanda, together with King Faisal Hospital. We are trying to collect samples that will be sequenced and identified all the mutations that are associated with anecdotal resistance mentioned by physicians. And from there, we'll develop a strategy to overcome this resistance. And for this, clinical trials will be performed. And I know the Institute of Global Health Equity Research is interested in clinical trials. Therefore, this will be a line of collaboration. But I also know that Global Equity is interested in metabolic diseases and genomics. Therefore, we have a couple of research interests that will help to build our collaboration. I wish all the best for the launching ceremony and look forward for collaboration and implementation for the interests of Rwanda and Africa.
My name is Dr. Ann Sumner, and I bring you greetings from the NIH section on ethnicity and health. I would like to thank Dr. Christina Stefan for the opportunity to speak today, and I would like to thank Andrew and Bonnie Weiss for their strong and important support of the UGHE and the founding of this institute. I met Dr. Agnes Benhuahu in 2015 when she was Minister of Health and came to visit NIH. We were introduced, and 6 months later, with the strong support of Francis Collins, the director of NIH, and Roger Glass, the director of the Fogerty International Center, and the leadership of 2 institutes, Minority Health and Diabetes, we had the NIH Rwandan Health Program. This program moved with Dr. Agnes Benhuahu to the University of Global Health Equity, and that gave the program the opportunity, which is now in its 7th year, to really thrive. Each year, a physician from UGHE comes and works with me at NIH, and I work with the African immigrant community that lives in Northern Virginia, Maryland, and Washington, D.C., including the large Rwandan community. Each Rwandan physician learns to ask important clinical questions, collect the data, and then write up their research. Each physician that has come to NIH has left with 1 or more first author publications. These first author publications are so important because they give credibility to any grant application that they would apply to in the future. In addition, the physician learns to present their research orally. They give a graduation speech sponsored at the end of the year by the Office of the Director. The leadership of NIH, as well as the leadership of Diabetes and Minority Health Institutes, attend this lecture. And to further enhance our relationship between NIH and UGHE, we've recently started a Zoom journal club that's once a month so that students at both locations can present. And at UGH, it's the graduates of the NIH Rwandan Health Program that run the journal club. So altogether, the results of these interactions between UGHE and NIH is that trained clinical investigators are rejoining the amazing faculty at UGHE, and so that altogether a community of leaders is being established that can improve health care and help eliminate health disparities in Rwanda and beyond. Again, I would like to thank Dr. Christina Stefan for the opportunity to speak with you today, Dr. Agnes Benhawahu for our partnership that we've had since 2015, and Andrew and Bonnie Weiss for their strong and important support of UGHE and this institute. Thank you.
Hello, I am Dr. Joseph Radigan. I'm an associate professor at Harvard Medical School and the interim chief of the Division of Global Health Equity at Brigham and Women's Hospital in Boston. And I am delighted to join you today. Congratulations everyone who was involved in the founding and launching of the Institute for Global Health Equity Research at the University of Global Health Equity in Rwanda. I've had the honor and privilege of working with UGHE since its founding. The mission of UGHE has always been to both train the next generation of health professionals and leaders, as well as to advance research in global health equity. And today, with the founding of the Institute for Global Health Equity Research, that mission is closer to being realized. This mission is grounded in the long history of collaboration between IMB, PIH, and the Ministry of Health of Rwanda. For over 2 decades now, IMB PIH has worked closely with the Ministry of Health to advance health equity in Rwanda and beyond. This center will help catalyze this work by supporting scholars who are examining ways to overcome the social, economic, and geographic barriers to delivering high-quality health care to the world's most vulnerable, and to advance global health equity worldwide. Congratulations, everyone, and I hope we will be celebrating this day for centuries to come. Thank you.
Hello, and Maraho. My name is Leslie King, and I'm the board chair for the University of Global Health Equity. I'm coming to you from Rwanda, and I'm excited to help launch the Institute for Global Health Equity Research. Research is at the center of everything we do at the university and at 1PIH. This institute will allow us to collaborate with partners around the world. We're excited to have Christina Stefan on our team with all of her experience to help build those partnerships, and we're looking towards you for collaboration. Congratulations to the Institute for Global Health Equity Research on your official launch. Let's get to work.
So definitely a motivating speech, and let's get to work. But before getting to work, allow me to introduce our speaker. And we are extremely grateful to Dr. Patrick Mumbanzi. I have exercised, I promise you, and hopefully I will get it right, who took the time to be with us. It really means a lot. We really believe that we need to work together. That is only one way, and we are grateful for your presence and for your support. So Dr. Patrick currently serves as the Executive Secretary of the Human Resource for Health Secretariat. The mission of this Human Resource for Health Secretariat is to build the health education infrastructure and the capacity of the health workforce necessary to create a high quality and sustainable healthcare system. Prior to his appointment, Patrick served as Minister of State in charge of primary healthcare in the government of Rwanda. More than that, I would say he's a public health specialist with experience in designing, implementing, and monitoring health systems, strengthening strategies aiming at improving health, the outcomes of the health of the population. Throughout his career, he has worked on various initiatives aiming at tackling infectious diseases such as HIV, AIDS, TB, and infectious diseases. He has also been active in the response team for outbreak management, and please welcome him to give the next speech. Thank you so much for being with us.
Thank you very much, Christina. Executive Director, Partners in Health, Inshuti Muuzima, Dean, University of Global Health Equity, Professor Abebe Bekele, Director of the Institute of Global Health Equity Research, Professor Christina Stephan, distinguished academician, distinguished researchers, young researchers. It's for me a pleasure to be here at this official launch of the Institute of Global Health Equity Research. And we are very happy as the Ministry of Health to be associated with this event. For those of you who are coming from near and far, welcome to Rwanda. I hope that you are enjoying our country. So to the Institute of Global Health Equity Research, congratulations on this milestone. I was listening to you and I was thinking in my head that we were born almost on the same day. So we are twins. The Human Resource for Health Secretariat was created 2 years ago in 2020 in February. So we're born in a difficult time, but we are thriving. I want to start this speech by thanking and congratulating you all for the timeliness of this initiative and the effort that went into setting up and launching the program. Research and innovation are essential for health development goals globally and especially in Africa, as they serve to unlock challenges faced and bring about solutions that adequately respond to the identified needs. As you said, I started my career on a research project, a PMTCT project, which to date is the job that I treasure the most. It changed the lives of so many families, children. When we started the study, HIV transmission was around 40%. When we had our results, we were able to demonstrate that HIV transmission can be reduced to less than 2%. And that changed the guidelines locally, internationally. So that's a job that I cherish much because it has the capacity of transforming people's lives. In this journey, with this initiative, the Institute of Global Health Equity Research vision of training the next generation of top-class researchers in Africa and producing the most impactful, innovative research, there is no doubt that it will support the advancement of science and discovery while also addressing the needs of our community and contribute to the reduction of the health inequity, as you say, and inequality as well. Additionally, it will focus beyond the traditional boundaries of the diseases and health outcomes with the research agenda that will be expanded to encompass the various determinants of health, implementation research and cross-collaboration in different sectors to one PIH initiative and make local capacity building influence the health system as a priority. One of the things that we've noticed is that there are very few people who are in the clinical space who do research, and that's a shame because there is a lot of data that could be analyzed and generate knowledge, not only to our communities, but also worldwide. So with this initiative and with the partnership that has started, the training of the fellows that have started their fellowship training at the University of Rwanda, we are hopeful that we will generate evidence and new questions that we should be asking ourselves. it's important to know that the research that will generate the new evidence will not only improve the patient care, the practice will improve not only even our routines as a ministry, giving priority to things that matter the most. It will support the way we deliver care in the privileged communities. And I loved how that has been a recurrent theme in all that you said. So it's always togetherness. I love that. Vulnerable, underserved, community, and actions that have real impact. So those are great themes to keep. And we will hope that it also creates opportunities and capacity for the future generation to also impact significantly on the economy and the well-being of our societies. The countries that have great researchers definitely made progress. I thought that Dr. Agnès would be in the room. I've had the privilege of working with her 2 years. I've seen how she's been pushing the health sector to conduct more research, and it has value. Some of the people that she pushed to go into school now have PhDs. Most of them have PhDs, and that trend of loving research has continued. So most of the people who work with her had that opportunity to continue to study. I wish to conclude in really encouraging the South-to-South collaboration that you all mentioned, and I assure you that we were very supportive of the synergies that we want to create across all the different institutions in the country, and that you will have in the Ministry of Health and in the HRH Secretariat a good partner who will always be present to take on new challenges. So long life to the Institute of Global Health Equity Research. Wish you a lot of success, many papers out, many papers that are impactful, and they are really transformative to the people's lives. So thank you very much. Congratulations.
Dr. Patrick, definitely that is going to mobilize us even more to make all of us proud of the achievements. And now it gives me great pleasure to introduce our guest speaker, Professor Sir Tumani Korech, who is the founder of the Africa Research Excellence Fund and the first Emeritus Director of the UK Medical Research Council Unit, the Gambia, at the London School of Hygiene and Tropical Medicine. For over 30 years, Professor Korech, who is Gambian, from Gambia, has pursued 3 passions: improving outcomes of inpatient care in challenging environments, research into diseases that impact the developing world disproportionately, and building human capacity in health research in West, Central, Eastern, and Southern Africa. So in Africa. Professor Korech is an honorary fellow of the London School of Hygiene and Tropical Medicine and is a member of over 20 scientific boards and committee groups worldwide, which I'm not going to read all of them for you. So please welcome Tumani.
I don't have it. Christina? No, I didn't bring my, I sent it to you. You didn't?
No, it's there.
I have to.
Yours is there.
So where do I stand? I can't see it.
You can see there?
Okay, I can see
that.
Yeah, I can, yeah. Thank you very much, Christina. Particularly thank you for that very well welcome. And thank you for inviting me to this auspicious occasion. And may I, through you, thank your team for the excellent conduct of a visit to Butaro, which remains an eye-opener of what can happen in this our continent. Honorable Minister, Vice Chancellor, distinguished members of the High Table, distinguished ladies and gentlemen, all protocols respectfully and fully observed. I like to start off by quoting John Nkengasong, a friend of mine, who said that public health in Africa is in a state of neglect and dependency. This is true. But what is more important is that it is crying out loud for measures to be taken to change this appalling situation. Can I have next slide, please? Next slide. About 70 years ago, 75 years ago, research could only be described as a paucity of events. And if you went around Africa, you probably find this particular picture. That right at the top was what the South Africans would say Muzungu, and he or she would be the only researcher supported by cleaners, lab attendants, and that's how research was conducted. It's taking time, and things have changed. Things have changed, that there are many more research institutions in Africa, and the dynamic of the roles played by various scientists is also shifting. More and more, we're having competent Africans in the research world. But this is not enough. Next slide, please. I was traveling here to this beautiful city of yours when a lady who sat down by me asked what my profession was. So I simply said, a physician. It's easier to explain than any other thing. And she said to me, this monkeypox has come again. Every time I look around, I hear nothing but monkeypox. And I said, well, it's a problem that's been in existence for a while, but let's talk about it as we flew along. Next slide, please. These are figures that should make us all wake up and smell the coffee. HIV/AIDS became well known worldwide in 1980 when Luc Montagnier made the actual diagnosis. By 1983, it was a global problem. But when you look back at specimens that were stored in various countries and in various laboratories, a sample that was collected in 1959 from someone in Zaire turned out to be positive for HIV. What this tells us is that between 1959 and 1980, many, many more people had contracted the disease, and many, many more people had died. But it was not known until it obtained a visa and traveled outside of Africa. Then it suddenly becomes a global problem. The same thing for Zika. 1947, in a river in Uganda, Zika was identified in a mosquito. In 1962, Zika again was identified in a human being for the first time. But it's only in 2016, when it left the shores, again obtaining a visa, that everyone started talking about Zika and microencephaly and all the complications that it has. I don't need to dwell a long time on Ebola. 1976, again nothing until it went to America, went to Britain, and then the whole scientific community focuses on this. Neglected tropical diseases are with us. a disease that affects over 1 billion individuals, that affects the poorest of the poor. Malaria is with us, killing Africans every day during the rainy season. Work is ongoing, but not as fast as work has gone for example, the disease that we all talk about now today. Now let's look at some relevant statistics and see how much more we have to do. And that's why I'm so proud that institutions like yours are vesting an interest to address the situation, which every African nation should be engaged in. I sometimes overplay it when I say every country needs to do its own research. Maybe I'm overplaying it, but what I'm saying is if you do not do your own research, all you can do is wait for research findings and then try to adapt those research findings to your communities. And that may not always work. In 2014, the well-known journal, The Economist, published data showing that Africans were responsible for publishing between 2 to 3% of the global scientific publications. Has there been progress? Well, perhaps no. In 2018, in 2020 actually, the BMJ published data showing that Africans, again, were responsible for publishing just 3% of the covered papers. So between 2014 and 2020, we had not moved a lot. Some of you would say, well, not all work is published, but we can only rely on data to say this. Now, when you think about that, we occupy 17% of the world's global population. Yet we are host to 25% of the global burden of disease. I often say to my colleagues back at home that we are truly a greedy nation. We take more than our own share. Then you need to go about and look at the citation index published by the Clarivate Analytics in 2018, which classified leading scientists based on the citation index. And it showed that the world leading scientists numbered 6,040. And of course, you then say quickly, how many Africans are here? What have we done? How have things changed? And then you find this abysmal figure of 15. 10 from South Africa, the usual suspects, not necessarily all South Africans, but people who are living, studying, and working in South Africa. Now, when you look at the rest of Africa, the remaining 3 were from Egypt, 1 from Nigeria, and 1 from Kenya. I've already talked about the NTDs, but my feeling is perhaps it is time now for us to change the situation. This is all after millions of dollars and pounds have been spent on research capacity building in our continent. Millions. The way things have been done needs to be changed. You talk about research in our various institutions, scientists fly in, spend 3 weeks, spend 4 weeks, carry out research, hire the services of our bright and talented young people. They do all the work in correcting the data, and then they fly back away with it and publish things from within our own countries. Now, if I sat down one evening and I said, let me see who the top 10 research institutions in Africa were outside of South Africa. And can you go back to enlarge that, please? And you would see that's the usual suspects. In French-speaking countries, it's the Pasteur Institutes. In a country like the Gambia and in Uganda, it's the Medical Research Council of Great Britain. In other parts of Africa, it's the NIH, it's the CDC. And the Gates Foundation is also funding quite a lot. European Union, the German countries, the EDCTP are spending a lot of money in Africa. You would hardly be able to place an African-funded institution in that list. We don't fund research the way we should. We don't develop research capacity the way we should. The UK CDS were commissioned by the Medical Research Council of Great Britain to see exactly what is happening on ground, what is happening to research capacity strengthening. And the results were really, really, well, for me, not disappointing. But it showed that most of the monies that are spent on research capacity building are on PhDs and MScs, and very little money is spent on postdocs. Now, this is the formative years of any scientist. You've got your PhD, now you have to start thinking of your own research area. Now, if our governments don't fund that, you then have to depend on the usual suspects again funding you. And such funding that they provide does not necessarily provide sufficient funds to develop the African postdoctoral fellow. We are crying out loud for postdoctoral training in our continent. So what's been happening is that young, bright, talented, emerging talent wants to stay in research. What do? They apply to the usual suspects, the NIH for funding, the Wellcome Trust for funding, the MRCs for funding. And I was privileged to serve in many such panels, and I watched how these young people struggle in these interviews. So those who tried to win grants and can't get it, they try once and they fail, what do? They join NGOs, UNICEF, WHO, high-paying salaries, and they abandon research. And these are some of our brightest and best doing that. Those who want to stay in research have to be the handmaidens of research funded from overseas, research whose PIs are not necessarily from our communities. So to be able to do research, there are some basic skills that are important. Now, I already congratulated you for trying to set up a research center here, a much needed research center. The opportunities are many. We have high disease burden. I already referred to this at 25%. Malaria, 94% of malaria cases in our continent. We have the populations, we have the people, we have the samples, we have the specimens, we have the data. And we have a massive opportunity to find solutions to local problems by doing research. Now the challenges are quite clear. Where's the funding going to come from? Again, we have to go cap in hand outside. And I must say how grateful I am to all these funders who have been funding us to enable us to do work that is relevant to our society. Our research systems are weak. Research funding is unashamedly small. We are now entering the phase of developing mentorship and networking key to a successful research career. And we need state-of-the-art research laboratories to be able to compete internationally and globally. I would like at this stage to say we should all work together to encourage our governments to spend money in research. I wonder how many of us in the research world invite our ministers of finance to our meetings, research meetings, so that we can educate them about the need for this. It's an idea that some of us are thinking is key to make sure that they're represented. And we try to get them engaged at our ministries of health about what we're doing at the very early stage, preparatory stage of our research. Next slide, please. The continent suffers from being an extractive economy. Good examples are the cocoa. Farming cocoa under heat and rain, and then exporting this cocoa away. And it often lands in Switzerland, where fantastic chocolates are made. And we then go and buy these chocolates to serve our ladies, our wives, our partners. The same thing happens to our crude oil. We export our crude oil, and then again we import petrol, the finished products, etc. Sometimes I wonder whether we've ever heard of the word, two words, added value. Until we learn those two words and try to ourselves make our own fantastic chocolates, the profits will always continue to go outside. Now, we don't want that to happen to our science, as I've said earlier on. We have the population, we have the specimens and everything. All we need is to make sure that we know how to ask the relevant questions. We need to know how to design. We need to know how to collect our own data and not just collect them and send them away. But we need to have the skills to analyze those data in a way that we can publish in international journals and lift our rankings up from 15 out of 6,040 to where we should be, 17% of the population. That way we can do research that impacts our health, research that will directly help us to our economic growth as well. Next slide, please. Sitting in a panel at Houston Road, Wellcome Trust, the African scientist comes in. From my mind now, I was saying to someone yesterday, it's the same thing as happens in the UK. When you analyze the data of people who are being funded by the Wellcome Trust, you'll find out that 85% of them come from the usual suspects. They're from Oxford University, Cambridge University, Imperial College, UCL, etc. And the others are also RANDs. Now, what is it in those institutions that makes them win this funding, and that is not in the other institutions? And I think it's nothing more than soft skills. It's nothing more than mentorship being provided. It's nothing more than networking. And it's nothing more than being trained on how to make a research idea so impressive to panelists and to funders that they want to fund you and no one else. So how to change a research idea into a fundable research project. That together with postdoctoral funding in our countries, skill supervision and mentorship, and also all the support that you can get from colleagues and friends will make you become a research leader in Africa for Africa. Next slide, please. With this in mind, based on those experiences and my privileged position in the past, as having been a clinician, a researcher, a panelist, I decided to found a new approach to research. And so we created the Africa Research Excellence Fund. And our vision is as stated there. Basically, it's to develop a community of researchers in Africa, for Africa. The talent is here. If we can get our fellows to win funding, they will not leave our shores, or very few would. It's because they want to do research, some of them who go. That's why they go. And once they go, the chance of coming back becomes very difficult, if not impossible. Next slide, please. And once we do that, we hope we can nurture, provide them enough mentorship, and that we develop a community of researchers across Africa to become research experts and leaders capable of tackling African and global health research challenges. So RF focuses on the most vulnerable point in the career of researchers. We now today have many successful PhD and clinically qualified people. They want to stay in research. They do not have the necessary skills. So we focus on these individuals, and by providing them the necessary skills to win their own research and stay in Africa for Africa. Next slide, please. You need to identify these competent people, and then you need to provide them with all they need to grow. And if you do that, you retain their services. And we hope that through then they'll improve health, save lives, in Africa and globally. Next slide, please. So what do we do at RF? Our primary beneficiaries are the early postdocs and research clinicians or clinician scientists. We are resident in Africa. We understand the problem of our African scientists. And we did this by talking to all senior scientists as much as we could in Africa, trying to find out whether what we are thinking about could be successful. And once we did that, we said, oh, we've convinced ourselves, so now let's develop a program. And next, we developed an evaluation plan. And for our outcomes, we had our early outcomes that we wanted to see. That is, people who now develop the skills to write their own research projects themselves, people who are beginning to create networks, people who are beginning to receive appropriate mentorship. And for our long-term outcomes, we looked at publications in peer-reviewed journal, promotion within their own institutions, impact in their communities, and relevance to where they belong. Next slide, please. We took a three-pronged approach. The first one being win your own funds. Until you can win your own funds, you will not be a scientist. You'll be somebody helping others. So we created a grant writing scale. The first thing we do with them when they walk into the room is to help them to develop a professional development plan. Find out what they want, what they see is their future. Find out what they already know about how to get to their future, and help them find the solutions of what is left to grow and become what exactly they want in the future. It includes budgeting, because sometimes it's amazing how a beautiful project is written, but the budget is something that no one will fund. If 80% of the budget is going to go to your salary and 5% to vehicles, no one will fund that sort of project. So it's key that people are aware of these things. The second arm is our research development fellowships. I said earlier on that there are certain institutions in the UK that we all know have in their DNA the ability to win research funds. So through competitive selection, we identify young emerging talent. And let's say, for example, somebody wants to become an epidemiologist. We will fund you for up to 9 months at the London School of Hygiene and Tropical Medicine. But when you land, there'll be another 50 people at that same level of yours. The DNA in the London School is to win successful grants. The mentoring is there. Developing of network is automatic. And by the time you leave the London schools in 9 months, you should almost have ready in hand an application, a grant application for funding from the usual suspects, the MRC, the Wellcome Trust, the NIH, etc. We also believe in research capacity development, and that we emphasize. But you must also one day become a research leader. So we have a research leadership training program. And this one we collect, we appoint, we select fellows from different institutions, 4 or 5 institutions at the same time. And those fellows are accompanied for training by a research lead. The research lead is pivotal to transfer the learnings of the fellows during our training into the institution where they come from. And basically, we want them to become extraordinary research leaders with empathy, research leaders who have trodden the path of the people they're developing, and more importantly, research leaders who can communicate. Communication is key in science. You must not only be able to speak to your cleaner in your office, but you must be able to communicate to your colleagues in the science field and to policymakers as well. Next slide, please. Next slide, please. Next slide. Okay, I'll go ahead. Basically, the next slide will show what we've achieved to date in the 6 years that we've been in existence. We've successfully trained 422 fellows who are winning their own grants and publishing their own papers, being promoted within their own institutions, and becoming increasingly recognized. We focus on making sure that they remain in Africa by encouraging them to stay together. We believe in training not just people who are already from different places have received COVID vaccines. In Africa, we're talking about 10 to 12%. And I'll tell you why this is happening. I am totally convinced that if we are in a position to engineer our own COVID vaccines, like India has done, then today we would have been vaccinating more people in Africa than before. And this again brings me to leadership. When you look at Cuba, they are poorer than most of the African countries, yet they have engineered their own COVID vaccine. So without good leadership, we cannot move forward. Africa's acceptance of building manufacturing, COVID-19 manufacturing sites leaves a lot to be desired. If we look at the experience of car plants, the building of car manufacturing plants all over the world in limited resource countries, it has not made those countries to manufacture their own cars that they've designed. Africa needs the science to engineer our own vaccines and move forward. And it is this competent, young, emerging talent that we should focus on. I came particularly pleased to come here today to explore potential synergies of our own Africa Research Excellence Fund and the Institute of Global Health. There are so many things we can do together. We can collaborate. We can collaborate. We can seek for funding together, and we can also develop programs focusing on this region in Africa. There are so many good talents in every country, but not every country is endowed with the opportunity to develop those talents. So if we come together, seek for funding, we can do things that will prove that Africa can do it as well. So one other key thing I would like to emphasize here is that we have recruited over 70 mid to senior research careers to act and support RF as reviewers in the work we do. So I'm here opening that invitation to all of you who are senior researchers or medium career researchers to apply and join our College of Experts. We're also proud that of the 422 that we've trained to date, over 400 of them are members of our alumni. What a rich treasure we have here. And more importantly, that some of the alumni are now being trained to deliver the lectures, to deliver the training that we already have. Next slide, please. Here is an example of a successful RF fellow working on hepatitis B, a disease which kills over 2 million people in Africa a year, who affects over 2 million people in Africa a year with over 700,000 deaths. And this is a young RF fellow we've sponsored, spent 9 months at the Imperial College, went through our grant writing process, and had some training in mentorship and networking, and won £400,000 to carry out his own research. So he's on the pathway to becoming independent. Next slide, please. The next one shows Agnes, a young scientist from Uganda, who approached me after a grant writing program to say, I now know how to win research funding. Go ahead and win research funding, I said. To date, she's won over £3 million of her own research funding. And because we transcend language barriers, we have a successful story to tell about a Senegalese who we sent to Liverpool, who at the end of his training in Liverpool has since won £350,000 to carry out his own research. Next slide, please. We work all over Africa, but when you look at that map, you will see that the middle area, often referred to as the dark corridor, we are yet to penetrate. And these are the people we call the underserved countries, and we're prepared to focus on them. In fact, we've run 2 grant writing programs for these individuals already. Next slide, please. I've already referred to this one. Next slide. For Africans to succeed in research, we need our governments to put their money where their mouth is. I believe we need to develop regional state-of-the-art research centers. The time for nationalism is gone. The time for regionalization is something we should be looking for. Every center of excellence in any of our countries should open up as you plan to do and make it a regional center of excellence. We need to build fantastic clinical trials hubs jointly funded by our governments and from people above. I do strongly believe that if we have clinical trial sites of par excellence, this chronic delay in getting drugs to Africa could be shortened, because the clinical trials of those new drugs could be done at the same time that they're being done in Europe or in America. And I believe that if we have the quality of labs that we need and the human resources that we need, major pharmaceuticals will be keen to do work with us. The Chinese experience is something we can benefit from as well. China used to be 10 in line for the number of publications 10 years ago. Today, in terms of numbers, they are number 1. I'm not talking about quality. How did they achieve this? They achieved this by bringing back their scientists from the United States, from UK, etc., building them state-of-the-art laboratories, paying them the same salaries that they receive in those countries. We can do the same and get our scientists back. Go to any institution in the world, and you'll find a very competent African there. The other thing we've tried is dual applications, dual appointments with our leading scientists, African scientists, in Harvard and other places. By appointing them, giving them that opportunity, they can spend time in our countries and do some valuable work and develop research capacity in our local communities as well. We talk about equitable partnerships, and I've heard it here several times. The time for rhetoric on this is gone. We should now really mean it and practice it. Next slide, please. Globally, 30 to 32% of scientists are females. In Africa, the figures are low. It is the right of a woman to become a scientist. It is their right, their given right. And I can say no more than to say, if you have 2 hands, a male hand and a female hand, and you want to use one hand, the individual who uses both hands will definitely walk faster and run faster in the farm. Let us engage our women. They are perhaps even better than we are, so we must make sure that we give them that opportunity. We talk a lot about decolonizing science, and a lot of talk goes on now at the London School, at Oxford, at the Wellcome Trust, that they're all crying out that science should be decolonized. But for science to be decolonized, we need to train our people in a level that they can take the lead. And that's why I welcome this new initiative that you're going on. Finally, I'd like to talk on my final word here, which is meritocracy. The problem we face in Africa is the love or want to fit square pegs into round holes. Let us look for the people who can lead based on merit rather than who they know. Political appointments into senior university positions must cease now. Next slide, please. I've already talked about what we can do together, so we can move on to the next slide. And when you look at this people who receive funding from, I can now proudly add the Gates Foundation, the Roche and Genentech Foundation. What is missing there is African governments or African philanthropists. How do we convince these people to start putting their money where it should go to improve health in our continent? Next slide, please. If we can do that, science in Africa will flourish. Our young scientists will become scientific leaders of tomorrow, globally recognized, playing international roles, and saving lives and improving health in our communities. I want to thank you once again for this opportunity, and I wish you all the very best. You have taken a bold step. It is the right step. Well done.
Thank you so much, Tumani. That was really inspiring, and we are really looking forward to our collaboration with RF and many more. So we almost at the end of our program, but before we still have a collage of videos of support. I don't think we are going to play all of them because we received so many from almost every single corner. They wanted to wish us well and they wanted to be here, but at least we have at least another collage of few minutes that we would like to share with you.
Hello everyone. My name is Gene Bookman, and I'm joining you from here in Boston, Massachusetts. I'm the director of the Center for Integration Science at Brigham and Women's Hospital and Harvard Medical School. I also co-chair the 22-country NCDI Poverty Network. I recorded this video because I want to congratulate you all on the launch of the Institute of Global Health Equity Research at the University of Global Health Equity, otherwise known as the IGHER. I know that your institute has the goal of becoming Africa's leading institute for global health equity research, and I know that IGHR hopes to do this through a variety of research efforts, including clinical trials. What makes IGHR's work particularly original is that it encompasses issues that are typically not addressed in global health research, but that are critical to health equity. These issues include, for example, the social determinants of health, the impact of digitization, and the particular challenges of scaling up interventions. At the same time, IGHR is part of the One PIH family and is committed to training future generations who are focused on the health of the poor. To accomplish this goal will surely require more resources, and IGHR has already started on the journey of supporting research careers in Africa so that there is a critical mass of leaders in the region. The faculty of our center here in Boston have a long history of collaboration with leaders at UGHE, particularly through the Lancet Commission on Reframing Non-Communicable Diseases and Injuries for the Poorest Billion. Our work together has shown that the next generation of progress towards universal health care will require a new science of integration for global health equity. While much progress was made in the first decades of the century through a vertical focus on priority infectious diseases, there remains a so-called long tail of both non-infectious and infectious conditions that are seldom lethal in high-income countries, but remain a death sentence for the poorest children and young adults in lower-income countries. We hope to work closely with the IGHR to identify the scalable, integrated units of operational effectiveness in healthcare delivery that can fight these complex problems. One example of this kind of integrated unit is the PEN+ strategy to fight type 1 diabetes, rheumatic heart disease, and sickle cell disease. This strategy was recently adopted by all 47 member states of the World Health Organization's African region and is already being implemented in 14 countries, including Rwanda, which has scaled this approach nationally. We hope that leaders at IGHR will develop the capacity to develop and scale these kinds of innovations in other areas, such as advanced gynecologic and breast health, newborn screening, and acute care, to just give a few examples. If IGHR is successful, we think that Africa will see decades of rapid progress in health equity. Congratulations again, and I hope to see many of you in the United States and in Africa.
Hello, UGHE.
Greetings from Belgium. I'm Dr. Mazarati Jean-Baptiste, a molecular biologist and a molecular oncologist in essence. I'm so excited today to hear about the launch of the Institute of Global Health Equity Research. It adds up a third dimension to UGHE. It expands horizons for our future doctors. It opens the prospects of a biomedical education program. It will change de facto the landscape of our diagnostic power in Rwanda. I can't wait to see this endeavor be brought to fruition. Congratulations, félicitations, Imana ibarinde, murakoze.
Congratulations to UGHE on this important day in launching the Institute for Global Health Equity Research. This is an incredibly important endeavor, and as an advisor to the CRI Foundation, I've had the privilege of having a front row seat in the development of this institute and the immense effort that it has taken by all at UGHE to get to this point. I've been lucky to visit UGHE a few times now and meeting the brilliant students that have been taught there. And it's exciting that now they will not only have the opportunity to learn the best in delivering healthcare in Africa and around the world, but that they will also now have the opportunity to learn and apply the skills to generate new knowledge on how we can reduce suffering and improve health. So congratulations to all of you, the VC, the Dean, Professor Christina, and the brilliant faculty and staff at UGHE. I look forward to celebrating future successes with you all.
Okay, so hi everyone. My name is Annie, or more officially, Marianne Hartley. I'm a clinician and research scientist based at the Swiss Institute of Technology, or EPFL. It's in the French-speaking region of Switzerland in the city of Lausanne. It's here that I have a research group called Intelligent Global Health, where we try to make data-driven tools for low-resource settings specifically designed for Africa. I'm also a South African, and I spend all my clinical time in a volunteer capacity here in beautiful South Africa. And we are all just really excited and proud to be among the first collaborators of UGHE, a university dedicated to our collective passion of global health. Our team will be working with Christina Stefan of UGHE to build an intelligent telemedicine platform designed specifically to work and function in Africa, and it will be deployed in 3 countries. So from Switzerland all the way to South Africa, EPFL wishes UGHE the best of luck and success, and we look forward to collaborating with you. Thank you.
Hello everyone, my name is Alamayo Gabro-Mariam, and I work for Catholic Relief Services as a Chief of Party for Inclusive Nutrition and Early Childhood Development program that is being funded by USAID. This program is being implemented in 10 districts of Rwanda with the aim to improve maternal, infant, child, adolescent nutrition, developmental, functional, and health outcomes, targeting approximately 4 million people across the 10 districts. The University of Global Health Equity is one of our consortium partners under the INCD mechanism and brings a unique expertise to promote learning in evidence-based programming. CRS collaboration and partnership with UGHE creates an important space to bridge the academic and implementation walls, to translate theories into actions, and to systematically document promising practices for further learning. As I speak, UGHE is leading 4 critical learning exercises under the INCD mechanism, and we are optimistic that our joint efforts can positively impact strategies, policies, and practices in relation to development endeavors in Rwanda and even beyond. That said, I would like to congratulate UGHE on its move to establish the Institute of Global Health Equity Research that can help us expand our horizons of learning. I'm looking forward to collaborating with UGHE in the newly established institute even more closely to promote evidence generation that can improve the quality of services in the public health domains of our mutual interests. I want to really congratulate UGHE once again, and good luck with the new institute. We're together. Thank you so much.
Hello, I am Temidaya Fadelu, medical oncologist at the Dana-Farber Cancer Institute in Boston. I'm also an instructor in medicine at the Harvard Medical School. I am originally from Nigeria, and since 2013, I have worked closely with the PIH oncology team to support the care of patients with cancer at the Butaro Cancer Center of Excellence. I lived and worked in Rwanda for 2 years from 2013 to 2015. And since 2015, as a member of the Center for Global Cancer Medicine at the Dana-Farber Cancer Institute, I have continued to work closely with the Butaro program. We have supported the development of clinical protocols, as well as other clinical innovations, capacity building of clinicians, as well as the development of implementation research at Butaro. I am very excited to hear about the vision of the newly formed research center at UGHE.
Good afternoon, good morning, good evening. I'm absolutely delighted to be joining you, although sad to be doing it virtually, for the launch of the Institute of Global Health Equity Research. My name is Lisa Hirschhorn. I'm professor in medical social sciences at the Northwestern University Feinberg School of Medicine and the director of the Ryan Family Center for Global Primary Care. I've been working with the University of Global Health Equity since actually its start, and have been delighted to be serving as adjunct faculty, building capacity, most recently for implementation research. The Institute is really absolutely critical and is poised to become not just a leader in global health research, but also redefining how we do it, how we design it, who does the research, who benefits from the research, and very importantly, how it's used to have the maximum impact in saving lives and reducing avoidable harm. I wish it all the best. I am looking forward to ongoing collaborations in grants, in capacity building, and in other areas as well. And again, congratulations and best of luck.
Hi there, I'm Fred St. Gore, and good morning, good afternoon, or good evening from wherever you are around the world watching this. This is an extremely exciting celebration, this launch of IGHER. This is something that I've been waiting for quite a long time. So I have been a long-time supporter of UGHE. I was there early on when the idea was hatched. I saw the first groundbreaking, I saw the ribbon cutting, and then I had the great privilege and actual pleasure of being on campus on multiple occasions to spend time with the students and teach. And every time I come away from campus, my time on campus, I'm inspired of just the incredible individuals, the incredible personalities, and the growth of these individuals who are really going to change the world. That said, I'm equally, if even more enthused about what the mission and goal of IGHER is. I'm a physician, I'm a researcher, I'm a clinician, and I am thrilled that IGHER is really at the tipping point here of becoming a global catalyst for lots of institutions around the world to really further the mission of global health equity research. They'll do it basically on a clinical level, they'll do it in a database level, they do it in a way with extreme quality. And it's a real privilege and pleasure to be involved with that, engaged with that. I hear Paul's words in my ear, the really important aspect of global health equity. That is our mission, and that is the mission of this remarkable research institute. And it's an incredible privilege, it's an incredible pleasure to support this in any way possible. And I hope you all have a wonderful celebration today as we launch this remarkable institution. Good luck, and thank you for letting me be involved with it.